Happening today, it's International Overdose Awareness Day. This comes after a record year of overdose deaths in Tennessee. Nicole Smith joins us now in the studio with how state leaders are trying to save lives amid the pandemic.
Yeah, this International Overdose Awareness Day, Nikki, comes a year after more people died than ever of a drug overdose in Tennessee. Preliminary data from the CDC shows more than 3,000 Tennesseans died from a drug overdose in 2020. In 2019, that number was more than 2,000. When the fiscal year 2021 ended in June, the state's regional overdose prevention specialists had distributed more than 71,000 naloxone kits and recorded more than 11,000 opioid overdose reversals. During the pandemic, behavioral health treatment and prevention experts have had to pivot and change how they offered services during the rising COVID-19 cases. In-person meetings became virtual. Regional overdose prevention specialists gave out naloxone to people's front porches or even took them to parking lots. And now they are still seeing the effects of increased use of substances during the pandemic. So today, state leaders and community groups are hosting events to remember the lives lost, celebrate the survivors of overdose, and encourage people to prevent deadly overdoses in their communities.
It goes back to where I spoke about the history of opioid use disorder in our state, the history of the opioid crisis, which is really maybe the prescription drug use crisis, but now it's transitioning to more of illicit substances. Maybe it's fentanyl, carfentanil, basically analogs of an opioid, but then also the shift to stimulants. I think a lot of it is that stigma piece, how we talk to each other, how we talk to or about, I hate to say it that way, individuals who actively use substances, and how we can be supportive.
Experts say the pandemic really created several conditions that fuel the increase in overdose deaths, including a disconnection from recovery resources, job loss, economic uncertainty, increased stress, and anxiety. Anyone who needs help can call the TN Red Line at any time. The number is on your screen right now, 1-800-889-9789.